Today let us see about scans in pregnancy. You may have doubt whether the scans are safe in pregnancy or not. But the imaging studies such as ultrasound, MRI are safe in pregnancy, whereas X-ray and CT are not because those are ionizing radiations. So whenever you think you are pregnant, never go for an X-ray or CT scan from second half of your menstrual cycle. So let us see now what scans are required and when they should be taken. The first scan is called as early pregnancy scan because this is done as soon as you miss your period. And this scan is used for confirmation of pregnancy, whether it is within the uterine cavity or outside the uterine cavity, called as ectopic, which is very dangerous to your life. And it also checks the viability of the pregnancy. We can see cardiac activity and also multiple gestation, that is twins or triplets, also can be seen in this early pregnancy scan. NT scan is done at 11 to 14 weeks and we measure something called as nuchal translucency here. And if it is greater than 3 mm, then the fetus might have structural or genetic abnormalities. And along with NT scan, we do double marker test measuring beta HCG and PAPA, which tells us the risk of having chromosomally abnormal fetuses like fetuses with Down syndrome, trisomy 18 and 13. Next, let us see the most important scan, anomaly scan, which is taken between 18 to 22 weeks. Here we look for anomalies in brain, face, heart, spine, lungs, kidneys and etc. Apart from looking for anomalies, we also check for general baby growth, its weight, placenta, liquor. Next is growth scan, which is done in your third trimester, and the frequency of this usually depends upon your condition. If everything is normal, it is usually done for once or twice. No need to have the scan every month of your pregnancy if everything is normal. In this scan, the weight of the baby, the position of the placenta, the amount of the fluid in which the baby floats is also calculated, and also the blood flow to the baby is also calculated and it's seen whether it is adequate or not. For calculating the blood flow and observing the blood flow, we have Doppler. So, a normal pregnant woman requires only these scans. The requirement of additional scan is determined by the special conditions, like for example, fetal echocardiogram, which is taken if we find any abnormalities in the heart during the anomaly scan. And we have something called as 3D scan, which usually improves the visualization of complex structures and also helps to calculate tissue and fluid volumes. It is usually an adjunct but not a replacement for 2D scan. Biophysical profile is something we need to know. It is nothing but scoring of our baby. Whenever the fetal movements are decreased and are not as before, the doctor usually asks us to go for biophysical profile and Doppler. We know that Doppler usually checks the blood flow to the baby. So what is this biophysical profile? It usually measures the fetal breathing, its movements and tone, and also the fluid in which it floats, and also the fetal heart rate changes are also seen. Each component is given a score of 2 and the total score is calculated. Based on the score, the further management depends. Hope this video has given you some information about scans in pregnancy. Thank you for watching. For more such videos, subscribe and don't forget to like and share.